And to follow that experience, we wrapped up our trip to Kathmandu. And on a personal note, I just want to thank especially Ali and Amit since they've been here. We've already shared so many experiences and talked about how mutually beneficial our travel and our trip was, and it means a lot. So we went on this crazy trip with Richard, and so I want to highlight our activities in Kathmandu. We attended and were happy to be invited to the Spine Conference, which was the first spine conference for the Neurospine chapter of the Nepalese Society. And the entire conference was an update on spine surgery. And I think you saw some of the pictures, or will see some of the pictures of how great the meeting was. We were honored to be invited by Professor Sharma, who Richard has developed this amazing relationship, and I think that's why it's such a special event for those that have participated, as well as Professor Amit Thapa from the Kathmandu Medical College. So we had a 2.5 days of a full set of both professional and personal events, and this is the brochure from the Spine Conference. We were fortunate enough to at least share our personal and clinical interests and expertises, first at the Kathmandu Medical College on September 20th, and we all shared in some lectures and some cadaver models on some specific areas such as SI joint fusion, lateral lumbar fusion techniques, and it was an honor to sort of help some of the general medical officers and the residents and spine surgeons from across Nepal who had attended that. We had a special section on minimally invasive spine surgery, and again got to share our clinical knowledge and our expertise. And I think as neurosurgeons that give talks and lectures, we do it all the time, and we think that's great, and that's how we give back. But this was really the smallest part of, for me personally, giving back. The modules of workshops were spectacular to have that interaction one-on-one with the local neurosurgeons. And probably the funniest story, and I'm surprised, where did he go? I'm surprised Farouk didn't share it, and I'm glad there aren't any pictures of watching a slightly overweight U.S. neurosurgeon trying to get into their scrubs. I was probably sweat off about 5 pounds by the time I got those scrubs on for us to go into the operating room. So our second day, we got to participate in the conference, the formal conference at the Hotel Schenker, and again got to share our experiences on specific topics such as cervical disc arthroplasty, outpatient spine surgery, and just a quick story. In the U.S., we think so much about moving inpatient spine surgery into the outpatient world and all of the benefits from the standpoint of patient care and resource utilization and insurance reimbursement and all that. And I realize that when we go to these other countries, they don't care about that. That's not important to them. Patients stay in the hospital for days and weeks at a time because culturally and financially, that's the right way to do it. And so I learned a lot just from sort of picking the topics that I selected to talk about. I'm the expert on this and expert on that. And next time, I'm not an expert. I'm just there to share my knowledge as a neurosurgeon. So that was very eye-opening. But we got to hear, and I certainly learned from all the speakers, some of the things that they're interested in, including hyperlordotic cages and lateral fusions. I always learn something about medical legal stuff from Rich. And these are some pictures from the conference. My favorite really is the top right, where we got to share a lot of time with some of the younger surgeons and neurosurgeons and medical staff officers, those who are looking towards a career in neurosurgery. They haven't even really begun their career. And it was really exciting to just see the energy and the enthusiasm of their attendance to this conference with a lot of big-name neurosurgeons in that part of the world. For me personally, the most valuable part of the trip was our day spent at Tooth with Amit and the entire team. There you see on the left, we participated in their sort of morning daily report and grand rounds. I got to sneak away with one of the junior residents, and he actually took me through the unit and showed me some of the patients that they were caring for. And for those neurosurgeons in the room, think about this. In one room on the neurosurgery ward, there was a teenager myelomeningocele post-op patient. There was a pituitary macroadenoma patient post-op. There was an odontoid fracture post-op. There was a massive head injury, hemispherectomy, or hemicraniectomy patient, and then the patient that Amit showed. Those were patients all in one room, right? Those are patients that, some of those I've never taken care of in almost 30 years of neurosurgery. So it was very eye-opening, and I appreciated the time, especially that we snuck away and got an update on some of the other patients. And we've already talked, I'm hoping we get more to do more in the future with sort of that bedside teaching for the younger surgeons. Proud to see their neurosurgery ward, which was sort of new and refurbished, and they're very proud of the team room that you see there on the left, their conference room where they get to have their morning report and share their experiences of the patient care. Unfortunately, Amit already showed some of these pictures, so cat's been out of the bag, but this was the live surgery that we got to participate in on September 22nd. 42-year-old woman who had a history of back pain and was undertreated with her POTS disease. For the non-neurosurgeons in the room, that's tuberculosis infection of the spine, which creates deformity and pain. In her case, spinal cord compression and essentially paraplegia. She was so weak that for the past 6 months she was not able to ambulate, and her husband would literally pick her up from the bed to the chair, pick her up from the chair to the toilet, pick her up from the toilet and go back to the chair. And when I got home, I realized not only did this patient family have significant issues with her disability, they didn't have a wheelchair. They didn't have a bedside commode, things that we take for granted. They're laying all over the place in the hospital. We pick up the phone, call a case manager, and there's a new wheelchair, and there's a new bedside commode, there's a new walker, just like that. This woman couldn't walk for over 6 months and relied on her fairly petite husband to take care of her. So she was initially treated with anti-TB drugs for about 2 months, presented to Amit in the outpatient clinic. And, you know, when I complain about someone coming in the clinic with chronic back pain, here's Amit taking care of this lady who literally gets brought to his clinic. And so they put this team together and just have some selected pictures in the operating room. And it was actually kind of fun to see some of the pictures of some of the prior visiting surgeons in that same operating room and to understand what kind of care is being delivered there. So lots of preparation. There were lots of conversations and lots of meetings going around. The first picture is really just us talking about the proper positioning of patients, and someone showed the articles on how that's one of the most cited articles on the video is patient positioning, so how important that was. They have a phenomenal anesthesia team and neuromonitoring team, and we got to work with them and plan the surgery. Richard is always giving his advice to all of us and the surgeons. Farouk is there working with the nursing team. Bottom right, we're talking with the anesthesiologists. And it was an amazing team effort. And in many cases, I think, sort of forget about the team concept. This was the operation that we planned. You can see Farouk and I and Amit getting started there at the beginning. I will tell you, too, as I recall, it took quite a while to get 6 units of blood prepared for this major deformity correction. We had plans to potentially do an anterior approach along with a posterior approach. And then that true teamwork collaborative approach, probably within the first hour, Farouk and I lost a lot of blood. And we're having to stop and decide how we were going to change the plan. Were we going to do the anterior approach? Were we going to be able, and Rich and I had a plane to catch that night, so were we going to be able to figure out a way to get the surgery done with Amit and his team and get the patient the best result? So we had to have a formal stop about an hour into the operation. We sort of regathered our thoughts on what we were able to do, and fortunately, we were able to finish the operation. Actually, Farouk and Amit finished the operation, and you can see us working together. And the best part of this was the teamwork. So Farouk and I started, Amit and his team were watching, and then we just kind of slowly, gradually got all involved. And at one point in time, there were 5 surgeons, pairs of hands doing this operation, and that was just amazing. I do have to credit Rachel Bartle, is Rachel here? No, okay, I thought she was coming. Rachel, who's a Medtronic rep in Seattle. Medtronic donated, over 150 pedicle screws and instruments, so we all sort of shared in carrying the secret backpack through the airports with all of the donated stuff that we could not have accomplished the operation without that. There's Rich and I at the end trying to figure out how we can safely sneak out even though the operation wasn't finished. I know by the time I got home, I got this picture that Farouk had sent in the middle that they were successfully able to complete the operation, and Ahmed and his team. And so as you saw, this is the before and after surgical picture, x-ray pictures and the picture of the patient and her husband, and I intentionally tried to follow the HIPAA and black out her face, but I did not want to leave out her smile. And you've seen this video. I'll just get through that. We did have some time for quick pleasure activities. I'm not sure if it's Allison or Farouk who got that stupid picture on the left. I'm not sure what joke was told or what drink someone forced me to drink, but we had a beautiful dinner. We enjoyed the food, we enjoyed the company, and we got to actually share a little bit of some native dancing there, Allison, Farouk, and Professor Sharma. That was a treat. We did get a quick sightseeing visit into the Monkey Temple, as many of you know, was somehow not damaged in the big earthquake, or very little damage in the earthquake. We got up about 4 o'clock in the morning, and Allison and Farouk and I got to go on a quick sightseeing adventure, and no, we didn't climb Mount Everest like Rich did, but we actually got to fly by it in an airplane and take some great pictures. So the summary of our trip, both Maldives and Kathmandu, and Rich jokes about this, but I have to do this just for posterity, just to remind myself of what I did on the trip, because it was so dang busy. By the time I get home, I forgot where I was, what I did, and who I met. So from Tucson, Arizona, for this trip, flew a little bit over 28,000 miles, 9 flight segments. The team gave 25 lectures. We did 5 workshops, 3 live surgeries. As Ali mentioned, we did an L4-S1 TILA fusion, SI fusion in the Maldives, and a T7 to L2 fusion with instrumentation, and that should say Nepal. So many thanks to colleagues and now friends, Rachel and Farouk and Allison, and especially to Rich. So I have to tell a quick story. I know I've got the red sign already, but so we're on the private yacht with the boss, the owner of the 80K hospital, and Ollie's working his tail off in the hospital, but we got to have a little bit of fun. And so we stopped the boat in the middle of the Indian Ocean, and he says, okay, we're going to get the toys out. And so he gets out the kayaks, and he gets out the water tubes, and he gets out the wave runner. And I said, Rich, have you ever done a wave runner before? And he says, Rick, I don't do motorized things. And he had this sort of face like, I'm not getting anywhere near that thing. Said, okay, here's a guy that's climbed Mount Everest. He's done everything else in the world and more, and he doesn't do motorized things. So I ran out on the wave runner. He went out on a kayak with the captain of the boat and the boss, and he says, yeah, no, not going to do that. Well, super loans, and you could tell how much fun we had because that same slide shows up in all of our talks. So finally he gets on the boat. He won't, or on the wave runner. He won't get on the wave runner unless he has the captain of the ship with him. That's the captain of the boat, right, who's probably certified lifeguard or something like that. And so he's just about ready to take off and running over the tow line. And he's making a hard right turn, and look at the concern on his face. But I was able to get that picture. And that's how much fun he had, and certainly how much fun we had traveling the world with Richard Wones and doing global neurosurgery. Thank you.